I'm Amanda Olsen, and I'm a pelvic health physical therapist, and we're going to discuss the function of the pelvic floor muscles and some common symptoms that may be occurring that would warrant seeking additional care. So we discussed pelvic floor anatomy in the first video, and that the muscles function just like any other muscles, where we want them to be strong. We want them to be flexible and mobile to help support our trunk and to help us maintain continence, have smooth bowel movements, and pain-free mobility during intercourse or daily activity. Some impairments that can go wrong that may lead to symptoms can be that the pelvic floor muscles may be too weak, they may have poor timing or coordination, and they may also be too tight. If you think about what it feels like when you have a muscle spasm, such as in your upper trap, and you push on it and it zings and comes up over your head, that can also happen in the pelvic floor muscles, where we have little restrictions, spasms, or tender points that can also be driving pain. They are muscles just like everywhere else, so the good news is all of those things are fixable. So when we think about incontinence or accidentally leaking urine when you cough, sneeze, laugh, or if you have that situation where you're trying to get the key in the door and you start to leak urine or feel like you are, all of those conditions can be remedied with pelvic health, physical therapy, or occupational therapy. Some of the things that may be going wrong are that the muscles may have poor timing or coordination. Sometimes this happens after having a baby. So after being pregnant or having a baby, sometimes it happens after surgery, or sometimes it happens if you have bladder patterns that involve holding your urine for a very long time. So nurses, teachers, busy moms that aren't making time to go to the bathroom, holding urine for a very long time can sometimes lead to coordination patterns in the pelvic floor muscles that lead to incontinence. As we saw previously, the bladder sits right in front, the uterus and vagina sits in the middle, and the rectum sits back behind, and these are three tenants in a very small tent. So also any issue with one may cause issues in the other. With the muscles, when we cough, sneeze, or laugh or jump, we have a lot of pressure coming down into the pelvic floor. We need the muscles to be responsive and to contract. So under a normally functioning pelvic floor, when we do those big thrust movements like a big sneeze, the pelvic floor muscles contract so that they support the muscles and no urine is lost. So if you are leaking urine, it could be that you need to strengthen the muscles. It could be that you need to retrain that coordination pattern and have better timing for the force to come in. And sometimes it happens where the muscles are too stiff and there's not enough flexibility. So when the sneeze happens, there's some gapping that happens around the urethra and some urine accidentally gets out. So the treatments for that can be different. If the muscles are weak, it involves re-strengthening, rebuilding that timing and coordination, doing exercises of the pelvic floor, often involving activation and deactivation. And if the muscles are too tight, then you are oftentimes going to get some exercises to gently mobilize them. And sometimes that involves getting some manual therapy from a pelvic health physical therapist or using tools to help mobilize the tissue. For issues like constipation, oftentimes what happens is the pelvic floor muscles don't know how to drop and expand to allow for a smooth passage of the stool. In that case, oftentimes we recommend having good posture on the toilet, which involves having something under your feet. There's devices out there, little stools that can go under your toilet that can help prop your feet up, getting your knees above your pelvis to allow for opening of the pelvic floor during the bowel movement. You can also use phone books or old books that you have that you're not using to place under your feet just to get your knees above your pelvis. And then also learning how to drop and relax the pelvic floor muscles. And then additionally, it may be that you need manual therapy to release any muscles that are too tight. Pain with tampon use, with your evaluation and exam with a speculum at the gynecologist, or pain during sex may indicate some restrictions or tender points within the pelvic floor muscles themselves. Sometimes women will experience pain on entry, and sometimes they'll experience pain with deeper penetration in the back. From a pelvic health physical therapy standpoint, that tells us a lot about the muscles functioning in the front of the pelvis versus in the back. I want to reiterate that all of these are fixable conditions and that they are muscles and that they can be retrained. Another common issue that women experience is pelvic organ prolapse. Pelvic organ prolapse is when the organs of the pelvis, whether it's the bladder, the uterus, or the cervix rather, and the rectum, drop down into the pelvic bowl a little bit lower. That can feel like pressure, bulging sensation, or in some women it feels like their organs are falling out. And what's happened is the muscles oftentimes are not supporting the organs well enough and the organs are dropping down. That can happen with pregnancy or after a vaginal delivery. It can happen after certain surgeries, or if you've had a hysterectomy and the uterus is removed, those organs can sink down a little bit. The treatment for that is just simply retraining the pelvic floor muscles. In some cases, you may work with your physician to use a device such as a pessary to help better support the organs, but all of those conditions can be managed and you can go on to live a very active life doing the things that you want to do. If you are experiencing any of these issues, be sure to talk about it with your physician and be sure to see a pelvic health physical therapist or occupational therapist to get a plan in place to help you feel better. For more information and to discuss your unique condition, be sure to contact FemStrong Health. FemStrong Health is a collaborative team of multidisciplinary clinicians that work together to get you feeling your very best.